Hi everyone, my name is Anahita Rabiee. I'm a transplant hepatology fellow at Yale New Haven Hospital. Today I'm going to be talking to you about how the liver allocation system works. First, you will be evaluated by a transplant program. Once they have determined that you're eligible for liver transplant, you will be listed with the OPTN network, which stands for the Organ Procurement and Transplantation Network. And once an organ becomes available through a deceased donor, the program has an algorithm, runs through all listed patients and identify the ones that will receive the offer and ranks them from first to last. So I'm going to walk you through how the system works and how it does it. The first part is how sick you are, how sick is the liver. And you can think about it in two broad categories. One is acute liver failure, which will be listed as status 1A. They will be given the highest priority as they have very high mortality. All other patients with chronic liver disease will be listed based on the MELD sodium score. MELD sodium score uses different values from the bilirubin, the creatinine, reflecting of the kidney function, and gives you a combined score that ranges from 7 to 40, 40 indicating the highest score and indicating that you have higher mortality. So the system tries to prioritize those patients. There's also the importance of blood type. Usually it's true exact match, so a patient with blood type A will be receiving offers from organs that are type A. However, there are exceptions to the rule. Sometimes a blood type A patient can accept an organ from blood type O. Then it's the location of your transplant program from the hospital that the deceased organ became available. The new policy uses acuity circles that tries to prioritize the sickest patients first, however, tries also to minimize the amount of time that the liver or the organs are spending in transit, as it is best to transplant the liver within 6-8 hours at most from the time of the procurement of the organ. And lastly, once your program receives an offer, the transplant team will decide if this is the right offer for you as an individual. There are other factors that go into this decision, how sick you are, what other comorbidities you have, are you able to have a good outcome with this specific liver or not, is the size right, does it fit well? And once they make a decision, they either accept the offer, then you will be called in for a liver transplant, or they decline the offer. If they decline, it will go down the list to the second transplant program that has a patient listed, and so on, until a program accepts the liver offer. I hope this was helpful. There are a lot more information that you can look on the website, and the QR codes are on the poster, which you can scan and learn more about it. Thank you.